Welcome again for the second session. I hope you had a fantastic break.
Yes.
I hope you relaxed well. So we are going straight to objective number 2 for the second session. It's at 11 a.m. right now. So I'm going to talk about the 5 reasons why men do not report these GBV. The young men do not report these GBV cases. So 5 reasons why we don't report. So the first reason, number 1, is due to social stigma and shame. Due to the masculinity of men, they have that kind of masculinity. So young men may fear being judged or being judged by the society for not being able to defend themselves during the act of GBV, causing them to feel embarrassed or feeling shame. So due to the stereotype of masculinity, it can cause them not to report. So the second reason why they don't report is because of gender stereotypes and expectation. So for societal norms often dictates that men should be strong and they are not vulnerable to this GBV. So due to that thing or the norms that they have been fed, so you find that they will find the pressure will prevent them from seeking help or reporting these GBV cases when they fall victims of it. And then the third reason why these young men don't report GBV cases is because of fear of retaliation. Who knows what retaliation is? So retaliation it refers to the act of responding to insult or actual injury, offense or harm with the corresponding action, typically with the intention of seeking revenge. So retaliation is the act of you seeking revenge. So GBV may cause threat or intimidation to these victims. So when you have threats and intimidation, you find it hard to report the GBV cases. This may make them to not speak out about the GBV that occurred to them. And then the fourth reason why they don't report is lack of awareness and available support and services. So these young men, many of them, they are not aware and they don't know the resources that are available to them when they fall victims of GBV. So this could be due to limited outreach efforts for CHPs, because CHPs, your work is to go and educate people and to educate these young men about the ways they can do after they fall victim of GBV. So these men may lack awareness, meaning they will not go to report the case. And then the last reason is the distrust in the justice system, meaning corruption. Due to the past experiences they have had about, example like the Kenyan government, you'll find out that these authorities, they want to bribe before they help you. So with that mentality, it will just discourage this young man from going to report the case of GBV. So any question on the reasons why? Any question? Reasons why these men don't report? Any addition? Thank you. I'm sure we've learned something.
Do we normally have support services for the men who are affected by that? Let's say someone has been so
yes, we have a support system and counseling services. So when you fall a victim of GBV, in the hospitals, example in Kenyatta National Hospital, they have a mental health department where GBV department falls under that. So when you go to that department, they can give you counseling. If you fall a victim of it, they can give you counseling and ways that you learn to live with it at the end of the day. And I think with all the health facilities, we should include these departments, because men are really suffering until. So thank you, and let's go for a break.